Good morning, welcome. My name is Tara Torres. I'm a nutritionist here at Katy Integrative Gastroenterology, and this is Dr. Radha Chamarisa. And we're going to go ahead and go over constipation today and some tips and tricks and things to be aware. I'm going to go ahead and share my screen. So here's some key points we're going to cover today. Dr. Tamarisa is going to walk us through the definition, facts, symptoms, and causes, some diagnosis things, and treatment and prevention. I'll wrap things up by talking about what we can do with our diet and nutrition. Okay.
All right. So constipation is actually a really common problem that we might encounter in the gastroenterology clinic. And oftentimes there's confusion about what constipation really is and how to define it. So the definition of constipation for us is that you have less than 3 bowel movements a week. Stools may be hard or lumpy or difficult to pass. And sometimes there's a sense of incomplete evacuation, like you feel like you haven't completed a bowel movement and there's still stool in the rectum. And all of those things can qualify under the definition of constipation. Now, oftentimes I'm asked, what's normal? Is it normal to have, a bowel movement every other day? Is that, what is normal? And the truth is that, normal is different for every individual. And so sometimes it is normal for a particular person to have a particular pattern of bowel movements. And what's concerning is when that pattern changes. So if you've always been a certain way, chances are that it's not anything worrisome. But when you're a certain way and then the bowel pattern changes to something different other than what you're used to, that may be something that we need to look at. So constipation, as I said, is actually quite common, and the statistics are somewhere about 15 to 20% of individuals in the United States suffer with constipation. We do see it more often in women compared to men, and that may be because there's some, of course, there's some hormonal influence, there's some laxity that may occur in the pelvic floor, the muscles that control the defecation function. As they go through different phases of their life, including pregnancy and childbirth. As we get older, we know that the muscles in the pelvic floor that can, again, control the ability for us to have a bowel movement may change, may get a little bit more lax or less strong. Constipation can be seen more commonly in non-Caucasian populations. Diet has a huge influence on constipation, and I think we often don't factor that in. And when we're talking to patients about constipation, we need to be talking about diet and how that may be influencing bowel patterns. Of course, there's influence of certain medications. So again, we often have a long list of medicines to look at when we're seeing a particular individual, and I always try to go through them and see if anything jumps out as being obviously constipating. And a lot of these medications may fall into the pain medication category. And then we deal with what we call functional bowel disorders. So these are cases where it may be a factor of something in the gut, like the microbiome, for example, the bacterial populations in the bowel that may be influencing the way the bowels are working. So as we said, constipation symptoms are fewer than 3 bowel movements a week, hard lumpy stools, difficulty evacuating, feeling like you have to strain or push excessively in order to have a bowel movement. There are certainly some alarming symptoms and symptoms where, again, if it's something that's occurring as a new problem, you need to seek medical attention so that we can properly evaluate this. So certainly when there's any bleeding associated with constipation, we want to be evaluating this appropriately and try to understand where the bleeding may be coming from. If there is, as I said, a new change in the bowel pattern, this is somebody who may have been regular all their life, but all of a sudden they're dealing with a slowing of their bowel function, that needs to be evaluated. Of course, if there's any fever, chills, vomiting, nausea, any of these other associated symptoms, weight loss is a huge symptom, a red flag for us in terms of looking into this further. So as we said, constipation can be multifactorial, and there may be different things that are influencing the bowel patterns, and they're pretty much two big categories when we look at constipation. One is slow transit. That means that it's taking time for the stool to go from one side of the colon to the other in order to be evacuated. And then we deal with what we call outlet dysfunction or pelvic floor dysfunction. This is where the muscles that are controlling the ability for us to evacuate the rectum are not working in a coordinated fashion. So when I hear symptoms of constipation and try to make a determination on what the right approach may be, I do have to categorize this into these two big categories and then try to figure out how I'm going to approach an appropriate evaluation and treatment. So as we said, there may be so many things that may influence our bowel pattern, so it's important to do a comprehensive medical review. We have to go through, when did the symptoms start? What exactly is the pattern of bowel movements? Is there a family history of something that may be influencing the bowel patterns? Doing a physical examination where we're able to feel the abdomen and kind of evaluate for any obvious abnormalities. This is all important in the evaluation. There's certain tests, blood tests, for example. Every time I look at a patient with constipation, I look at whether or not they've had thyroid function evaluations, because the thyroid can really play a big role in regulation of bowel patterns. So a good thyroid evaluation is important to the workup of constipation. Stool testing. This is where, again, we may factor in what are the bacteria in the intestines, what is the microbiome or the bacterial population look like in the intestines, and this may help us understand whether or not there may be an issue with the actual bacteria causing or influencing the bowel patterns. Urinary testing may be important to us in order to rule out any other influencing possibilities. So the bowel, the bladder, and the uterus are all kind of in line with each other in the lower part of the abdomen. So if there's a problem in one organ, it may be influencing another, and so we need to look at possible things related to the anatomy and things that are around the rectal area that may be affecting us. X-ray testing may be useful to us. So there's actually a test called a Sitzmarker test, and this is actually a test of transit time. So we can use this to look at how quickly does a person process from the mouth down to the rectum? How does everything flow through the bowel? Is it, again, slow transit where the markers are sort of spread out, telling us that this is just a really slow colon, or do the markers concentrate in one area of the colon, telling us that there may be a problem in a particular situation, so or a particular area of the colon. So this is where we can possibly differentiate slow transit versus something that's blocking the passage from the rectal area, which may be a sign of pelvic floor problems. CT scan is something that we might use. This might help us look at any potential masses or lesions in the bowel or outside of the bowel that may be influencing bowel patterns. This may also be useful to us when we're talking about a potential blockage or obstruction, and this may be coming from adhesions. People who've had multiple abdominal surgeries where there's scar tissue that may be affecting bowel function. MRIs or magnetic resonance imaging, this is another technique of looking at various structures in the abdominal cavity that may be influencing the way the bowels are functioning. As far as diagnostic procedures are concerned, we may be looking at doing an endoscopy or a colonoscopy, trying to figure out if there's anything within the bowel itself that may be influencing a bowel pattern. of course, if there are alarming symptoms, rectal bleeding, for example, if there's blood in the stool, we need to be looking at, is there something on the surface of the bowel that may be producing that blood? And it's probably one of the most alarming symptoms that we see. You might think, well, why do you need to do an upper endoscopy if you're looking at somebody with constipation? And that's because there may be some issues that are going on in the upper GI tract, for example, a problem like gluten intolerance or celiac disease. Oftentimes the presenting symptom is diarrhea, but we do have a certain population of patients that may present with constipation in that scenario. Flexible sigmoidoscopy is a mini exam of the colon. So this is where we may pass the scope to through a small portion of the colon, somewhere to the sigmoid colon. And this is appropriate maybe in somebody who's younger, probably less likely to have any real significant or serious problems, who's having some rectal bleeding. Over the years, we've really gotten away from doing flexible sigmoidoscopy so much because we recognize that there may be issues that we miss on the right side of the colon. And so if we're going to put a patient through the evaluation process, oftentimes it is better to just do a full evaluation of the colon and get a look at the entire colon. So other testing we have here, defecography. Defecography is a test where we can actually look at the muscle function that controls the ability for us to evacuate the rectum. So this is a test where we may put some contrast into the rectum and then do a video exam of how the muscles are working as we try to defecate. Are there muscles that are working against us and limiting our ability to evacuate the rectum, or are the muscles working in a coordinated manner to allow for bowel movement? Another test that's helpful to look at the rectal muscles is manometry. This is actually pressure testing of the rectum. There are three major muscles that are going to influence the way we can empty the rectum. And if any one of these muscles is not coordinated or working together with the other muscles, then we're going to see some resistance to the passage of stool through the rectum.
It's a lot of comprehensive testing options out there. It's good to know for people to know what all their options are.
Yeah. Now, when it comes to treatment, we do look again at a big picture, and it's not just a matter of giving you a bunch of prescriptions and saying, here, go home, let's try this and let's try that. We really do need to look at every possible angle of how we can approach constipation. So it's really important to understand what the diet is, and we do know that there are certain things in the diet that may influence the way the bowel patterns look. And so, for example, in somebody who may be eating dairy, that may be influencing the way, if they're lactose intolerant, influencing the bowel patterns either to the point of diarrhea or constipation. We know that there are some fermentable sugars in the diet, and we call this a low FODMAP diet, for example, where that may benefit somebody who's constipated, removing some of the sugars or some of the irritants from the diet. Oftentimes we may recommend increased fiber supplementation. Now, fiber is a little bit tricky because sometimes in the patient who is constipated, the increased fiber intake actually makes them feel very bloated, because as they process the fiber in the gut, there's a lot of gas that can be released, and if you're not able to pass stool, then eating more and more fiber just makes people more and more uncomfortable. So I always try to get the gut working first and get good bowel patterns, or try to establish some sort of increased motility before I increase the fiber supplementation. There are certain over-the-counter options that we may utilize, and people often have already tried all these things before they come and see us. So by the point, the point where we're seeing them, they've been struggling with all these over-the-counter options already. And really, when I see a patient for constipation, again, it's not a matter of picking up all these over-the-counter products and trying them out. I really try to look at what is the underlying reason for this, and what can I do to correct that so that they're not dependent on all of these other products for regularity. There are prescription medications that we may utilize. So once we've determined what the underlying cause may be. You know, in the meantime, we may have to use some of these prescription products to give the patient some comfort and relief so that they can actually function as we're trying to figure out what the underlying problem may be. Exercise is really helpful to getting the gut moving. So I encourage people to go out and walk, you know, even if it's taking a walk for 20 minutes a couple of times a week. I think it's a useful adjunct to the treatment of constipation. We have here biofeedback therapy. So biofeedback therapy is where we actually retrain the muscles in the rectum to work better and in a more coordinated manner. So this is going to be for somebody who we've identified as having what we call pelvic floor dysfunction. That means that the muscles in the rectum, again, are not working in a coordinated manner, and we need to retrain the muscles in order to get proper coordinated movement. Surgery is generally a very last resort for us. So when I look at a patient and when I look at everything that I could possibly do to help somebody with constipation before I even think about surgery, unfortunately, there are some situations where no matter what we do, you know, the situation comes down to having, you know, requiring a surgical correction, either of a pelvic floor dysfunction or of something in the bowel that's actually inhibiting our ability to have any other treatment that works. As far as prevention is concerned, you know, we've touched on many things that we might do to help somebody with constipation. So again, diet, looking at getting enough fiber in your diet in the right setting, drinking plenty of water to help lubricate the GI tract and keep the intestines hydrated, regular physical activity. I do oftentimes ask patients to set a little bit of a regimen on how they might you know, have a bowel movement. So kind of setting a time of the day and in the morning, for example, you know, taking that 15, 20 minutes to just kind of relax and allow yourself to have a bowel movement. Sometimes we're on the go and we're so rushed going from activity to activity that we may even hold stool, and that's really not healthy because then you're sort of training your body not to go. And so, you know, allowing yourself some time to kind of have that good bowel movement on a daily basis is a good thing. We've talked about certain diets, and again, you know, when we evaluate a patient, we may find that a particular diet is going to be helpful, and this is where we will come up with a plan in terms of what things to eat or what things to avoid in a diet that may help with constipation.
Yeah, when it comes to picking the right diet for a patient, we have to take into consideration some of the other factors and things that they're dealing with. Fiber is, again, one of those things where in general, for a normal adult, the recommendation is 25 to 31 grams of fiber in a day, but this can vary depending on the patient. Some people do better with less, some people do better with more, and that just depends on other factors in their life. So we can find fiber in whole grains, such as your breads, pastas, oatmeal, and fortified cereals. It's also going to be found in legumes. These are going to be your lentils, beans, and chickpeas. Fruits and vegetables are great sources of fiber, and then also nuts. Big key in getting fiber to work properly and do what it needs to do is drinking water. You want to drink about half your body weight in water. You can get this from vegetable juices, soups, bone broth, those types of things. All of these should help make the stool softer and easier to pass. So I love your integrative approach. It's both traditional medicine, but it also takes into effect all of the things that patients can do on their own, like the exercise and the movement and the diet. And it puts a lot of control in the patient's hands. All right, so this is Katy Integrative Gastroenterology. Again, this is where we really do an integrative approach to not just gastroenterology, but wellness in general. So we have Dr. Tamarisa here, who is a GI specialist. She also has a PA and a nurse practitioner, Chelsea and Jenna, and myself, Tara Torres, here providing the nutrition aspect. You can find us at Katy Kingsland Boulevard, across the street from the Katy Mills Mall. We do have a website, kigastro.com. You can reach us at 281-869-3009. And of course, we're on social media, so come and find us. Katy Integrative Gastro.
Thanks, Tara.
Yeah. If you have any questions, please feel free to reach out. We're happy to help.
Thank you.